being able to understand diet is extremely important. Not using sugar products, not using dairy products, not using gluten products. So there are so many aspects of diet that we can really get into and maybe spend a whole session on that really are very important. And we give people a lot of very good information, valuable information as to things to avoid and things that are very helpful with regard to your diet. Sleep is another very important component. And also looking at what nutrients your body needs. So people go to health food stores, they read an article, they have a memory issue, they see a commercial on TV, they go out and they buy a product, but that product may not have the specific components that will be involved in regulating that particular form of memory issue.
Welcome to the Hope and Help podcast, where we talk about science and science-based tools for fatigue and chronic illness. I'm your host, Haylie Pomroy. I'm a #1 New York Times bestselling author of The Fast Metabolism Diet, a leading health and wellness expert. And that's right, you guys, I'm back in school again. I am finishing my PhD in neuroimmunology. That is because I am a fierce advocate for those in need of a little bit of hope and help. Today, we are going to talk about the brain. And when there are very difficult subjects, I always pull from my resource of physicians and friends and colleagues to bring you some of the most brilliant people to answer the questions that you guys posted for me. So today, I'm so excited to have Dr. Philip DeFina. Dr. DeFina, I want to thank you for being here. You have worked with many of my clients. You've worked with, obviously, us at the Institute for Neuro-Immune Medicine. Throughout the years, I have read so much of your work, and it's just, I'm kind of fangirling out, but I'm very thankful that you're here today.
Thank you. It's a pleasure to be here, and I'm very honored that you brought me onto your podcast.
Absolutely. Everybody is going to love this. First, get everybody up to speed about where you are and what you're doing. I know that you are a clinical director of some facilities globally and in the United States. Can you just give us a little bit of a feel as the community so we can get up to speed?
Okay, so I do research. When I was a professor at NYU Medical School in 2004, I set up a private research organization that would be more efficient than the university-based type of research center. So I set up the International Brain Research Foundation, which still exists. That's a 501c3 medical research organization. And we do partnerships around the world with monies that we get through government institutions and private funding on a number of different disorders, from childhood disorders like autism spectrum throughout the age spectrum to the adults with neurodegenerative issues. We have a big Coma and disorders of consciousness program, which actually led to the development of that foundation. And through the work over the years, we have over 300 people who had severe disorders of consciousness awaken. So I'm the CEO and Chief Scientific Officer of that organization. We have an international group of MDs and PhDs that are phenomenal scientists who contribute to that work. And then additionally, with regard to private practice, I direct a healthcare practice with a group of MDs and PhD practitioners. In Florida, it's the International Institute for Brain Enhancement, located on the campus of Delray Hospital. And then in Virginia, we have a similar organization, Advanced Brain Center of Virginia, and that's as well on a hospital campus, Reston Hospital in Virginia. So at those facilities, we do a lot of very advanced types of diagnostic and intervention procedures, many of which people are not aware of, and some of which are new and unique.
Hey guys, it's Haylie again. Right about now, you might have questions that pertain to you and only to you. Let's continue the conversation. Go to HayliePomroy.com/member and get a free 30-day trial of my membership community. You're going to love this place. Post your questions, ask your questions, grab some downloads, and let's get you the help you deserve.
So we have a very large, robust community, and our whole goal is to give them hope, right? And then give them solutions and ways to find help. And I think to say that you are a massive brain expert, but not just in the field of research, but actually in intervention. I mean, what I've witnessed in your practices is shocking and not the norm at all, which is why, I've had the pleasure of getting to work with you. But I want to just take a step back. You went over one thing that you said. You used the word coma, and in the years prior to getting to work with you, I'd read a lot about some of the work that you had done and some of the work that was remarkable. The veterans work, the work in TBI, brain injury, post-traumatic
stress.
Yeah, post-traumatic stress injury. I like injury instead of...
Absolutely.
Yeah.
I totally agree with you on that one. Yeah, definitely.
Dr. Daniel and I just had that big discussion. But we've seen you work with patients that are actually in a state of coma and change that. Can you talk to me a little bit about how that happened and how you got into that and how that progressed?
Well, there was original research that was done at the NYU School of Medicine looking at cats and their brain function in relation to coma on a study that was done with Dr. Joe Ransoff, who was chairman of neurosurgery. And based on a lot of the theoretical paradigm that came from that work, I put together a protocol which used electrical, magnetic, and chemical types of interventions simultaneously, because the brain is so complex that you cannot only do one thing. All of the major medical centers that are involved in severe disorders of consciousness and the rehab centers, the top rehab centers in the country, from Johns Hopkins to Yale to Mayo Clinic to Cleveland Clinic, they use one or two drugs. And they've been doing this for decades. And the brain is not that simple. So when I got involved in doing things where we were using electrical, magnetic stimulation, hyperbaric oxygen treatment, et cetera, that protocol became too advanced for those individuals, and there was a lot of pushback. But the results of that program were very significant. We have over 300 people that have come out of various states of disordered consciousness that were told by these other facilities that they had zero probability of recovery.
No hope.
Right. And hope is a very important thing. And over the years, we've developed all of the research capability to understand each and every one of those parameters. If I could digress just 1 second.
Absolutely.
In the 1950s, when I interviewed Dr. Albert Einstein at Princeton, it was a very interesting interview. They said, Dr. Einstein, in the future, how do you think the laws of physics and principles of mathematics will impact healthcare? And this was very, very insightful and interesting. So he said, once doctors understand the electrical and magnetic systems in the body from a diagnostic and treatment perspective, the use of medications will not be as necessary. And people laughed. Now, this is pre-computer, pre-MRI, pre-everything. Exactly.
Yeah.
And that's exactly what I'm doing, what Einstein said at that point in time. So we're using electrical, magnetic, and chemical analyses of using MRI spectroscopy to look at metabolic functions and chemistry. We're using EEG, QEEG, evoked potentials to understand the electrical status of the brain and the circuitry. And we're looking at electrical, magnetic, and chemical. And so basically, once we understand those three parameters, then we devise electrical, magnetic, and chemical interventions which work specifically for that individual. So everything's customized to the individual's needs, because once we understand where the chemical, electrical, and magnetic issues are, then we put together a protocol specifically to enhance that particular region to get the best result. And in diseases like Alzheimer's and various other progressive neurological diseases, we don't cure the disease, but we take a person from a very poor state of functioning and bring them back to a much higher level of functioning, because we optimize and enhance the system by changing electromagnetic fields and chemistry.
And there's such a deficiency in I'm going to call it brain medicine from a basic perspective, right? For a lot of reasons, a lot of things that we take, and Dr. Klimas always says, you can unpack the body, but you can't touch the brain. So many times medically, things don't cross the blood-brain barrier for one aspect of it. The other, to your point, is there is such a electromagnetic and electrical component, right? I always think this is an analogy that my brain goes through, is when we shock the heart from a cardiovascular perspective, we all consider that totally normal medicine, right?
Right.
We have defibrillators on, by the swimming pools, now in public pools, on a cruise ship. That electrical aspect of medicine, right, is so accepted.
Perfect example.
Oh, good.
Perfect example.
Thank you. In a cardiovascular perspective, there is more and more research that shows that there is more neurological electromagnetic activity happening than we can even imagine.
Absolutely.
In comparison to the heart. So it's such a normal aspect of medical intervention in cardiovascular.
100%.
Yeah. And so I love to see that carried over, and that bypasses that blood-brain barrier, the inability to impact the brain. But our brains impact so much. So I want to just talk, our community really talked about anxiety, depression, post-traumatic, right? Symptoms, and whether it's post-COVID, I'm going to just, or post-auto injury, post, horrible lawsuit, post-stress, post-divorce, whatever it is, whatever the episodic thing was, there's such an endocrine or a hormone impact. There's such a whole body impact. Can you explain to me a little bit how the brain controls all of these different things in the body? So
this is very important because neuroinflammation has a significant impact on hormones and the immune system because it's intricately interfaced with the immune system. So the signals from an inflamed brain can directly influence hormone production and really release the hormones while also modulating the inflammatory processes, creating a feedback loop in the brain, which is controlled by the hypothalamic system in the brain. And stress or inflammation triggers the release of cortisol into the brain. So that's a hormone that has the anti-inflammatory effects. And then there's something called cytokine signaling, so that the inflammation that occurs in the brain's immune system cells release cytokines that directly signal the hypothalamus, and in that process, triggering the release of hormones like corticotrophin hormone, CRH, and pituitary gland releasing like adrenocorticotropic hormone. These are key hormones that are required in regulating inflammatory processes. But you can do this by using something like hyperbaric oxygen therapy, which can actually interface on that system that I just discussed with you and reduce the inflammatory processes. It's like putting the fire out.
Yeah.
And once that happens in every disorder, stress-related disorders like post-traumatic stress that you were talking about before, depression, anxiety, and coma, brain injury, etc., all create inflammatory processes. And once we have that existing, if we try to treat the disease without reducing the inflammatory process, it's not possible. It's like wanting to reseed an area while a forest fire is going on.
Exactly. Yeah. No, I love that analogy. I want to take it to the hyperbaric chamber for a minute. I had a lot of exposure to it with, individuals with like wound care. We had an individual that went septic post a perforation with a colonoscopy, actually. And then my grandmother had a stroke. And when Gigi had a stroke, we were so fortunate to get her right into a hyperbaric.
Wow. That was the best thing that could be done.
Right. Yeah. So she actually went to Cedars Hospital, and then there was a private hospital down the road called Olympia Hospital. And it was really, really cool because the cardiologist, I'd been buddies with a couple guys over there, guys and gals over there. And they said, look, go down the road and put her in hyperbaric right away. So we actually moved her out of Cedars. Yeah, it was kind of cool.
That was great.
It was very cool. But it was remarkable. And I understand it a little bit, but can you explain to us what a hyperbaric oxygen chamber is and how it impacts the body?
So Hyperbaric Services of the Palm Beaches is the center I have here. Mm-hmm. And I have another one in Virginia, Hyperbaric Center in Reston. We take care of so many brain injured and stroke patients, none of which are covered through any insurance because they don't cover anything related to the brain. You were so fortunate with your mom bringing her there and doing this. So what happens is you're put into a machine. It's all glass. It's open so you can see, and they infuse 100% oxygen. We breathe in 21% oxygen. Wow. So we have 100% oxygen that's in the tank. And it takes several minutes, between 5 to 15 minutes, depending on what pressure you're putting the tank in. So a person goes, let's say, to 1.5 or 2 atmospheres. It can take 10 minutes or so to get to that atmospheric level. So you're laying in a tank with 100% oxygen under 1.5 to 2 atmospheres of pressure or more. And that bathes your entire body, all of your organs with oxygen. It reduces the inflammatory processes. It regenerates nerve cells, angiogenesis. It regenerates neurons, neurogenesis. So this process of giving pressure with 100% oxygen has a tremendous impact. And especially what you're talking about with vascular issues to the brain, you are helping that vascular system to reboot, reorganize, and recover very rapidly because it's deprived of oxygen due to stroke or due to blood clot or bleed in that particular area. So you're doing the exact thing that the body needs is to oxygenate itself.
But even my dad had type 2 diabetes, and he had a lot of very painful neuropathy.
Absolutely.
And the hyperbaric was phenomenal for him. And was that the reduction of inflammation or the regeneration of nerves or the
all of the
oxygen?
above? And you're right on target as usual. Absolutely. So great speaking with you because of the way you think through a paradigm of diagnosis and treatment. And you're 100% right. So the inflammatory processes involved in every disorder, the 14 conditions like wound care, et cetera, for hyperbaric, are all reducing inflammation. They're all helping those particular organs like the skin regenerate and the nervous system to reorganize itself and new neurons through the process of neurogenesis to reoccur. So this process, despite the level of disorder and where it's located, will affect the whole body. So when you come in for a diabetic wound, if you come in from with a cancer patient who's had very significant side effects from radiation, or you come in with someone who has a traumatic brain injury, all of those disorders will respond dramatically because of the reduction of inflammation, the production of new neurons, and the ability for the brain to reboot itself in that regard.
And, I'd had so much exposure to a lot of this when I was going through kind of my health crisis, but it was actually a patient of yours that I saw a photograph. I don't know if you knew I saw this, but the individual had a diabetic ulcer where you could literally stick a Q-tip through the toe because there was an open sore, an open hole. And I had seen the photography over the progression of the treatment at your clinic, and the wound not only closed, but it healed itself, and the toe was, it was amazing. I went, oh my gosh, my dad, why didn't I think about that? Why hadn't I thought about that for him? That was just actually what my Gigi, my grandmother, was a great cardiologist at Cedars that said, get out of here and go over there.
Wow.
Yeah, it was really cool. Actually, I appreciated that. He understood the limitations that he had to offer my family and how humble, right? To say there is actually better care. And I know that that's how you get the majority of the referrals. I'm very close to the doctor. One of my clients has seen you, the doctor that did the actual physician referral. Most of your patients, are there because there's someone that wanted more for their patient or their family member. And that was both the cases in my situation. There's an aspect of your practice that always has such a huge impact when I go over to your clinic, and that's the veterans piece. It's not that there's just tons of veterans coming in and out of there, cool men and women. I mean, they're just badasses, right? But it's the heart that all of your team has for those people. Where does that come from?
Well, okay, that's a great question, and that's something very close to me. And we just finished Veterans Day on Monday. So I was a veteran.
Thank you.
And in the Army. My daughter currently is on active duty. She's a behavioral health officer at Fort Campbell and works with the 101st. And basically, they have so many issues that they work on. My dad, 97 years old, who's still alive, is a Marine from World War II. My grandfather was in World War I in the Navy. So we have 4 generations of military in my family. And during my time of service in the military, with all I've seen with injuries, that cause post-traumatic stress, severe traumatic brain injury from blasts, and penetrating injuries from bullet wounds, etc. The exposure to various toxins around the world from burn pits, etc. Our military has gone through so much with regard to encephalopathies, brain syndromes, due to all these various issues, and the VA is treating them with antipsychotic medications at the level that is incapacitating them even further. So with that in mind, I put together a protocol years ago specifically for the military, and hyperbaric oxygen is one of the components. We use electrical magnetic stim, we do IV infusions, etc. It's a 1-month program. It's free for all military personnel that come in because it runs about $25,000 a month for all the things that we do. And we do this through private funding. People donate to our organization, International Brain Research Foundation. So it's really tremendous because these veterans are at a point in their life when they have no more hope. And many of them have given up, and their colleagues who have gone through the program, I have SEAL team members, I have Special Forces guys, I have U.S. Army Delta, Army Rangers, etc. These guys have been so broken with injury and no success in their treatment that they feel like there is no more and there's nothing else available. So when their colleagues come to them and say, hey, I've been there with you, you know that, this really helped me, you have to do it, and they push them to come in, that's what spreads the word. Because you need to have the bona fides to say, hey, Dr. DeFina is a veteran, he's treated all these veterans, and basically all the veterans that go there talk to other veterans that they know and say, listen, you know what I've gone through and all the difficulties I had with VA and DOD, et cetera. Now I'm in a different place. You need to go and do it. And that's what pushes them to come into the program.
Hey guys, it's Haylie, your host. I wanted to bring to your attention the possibility of coming in and doing a study with us. It is called the COVID UP study. And UP stands for Understanding the Post-Viral Phase. You have to be local in South Florida. There are 2 phases of this study. Let me give you the phone number. It's 305-275-5450. And the email is INIMresearch@nova.edu. We are currently looking for patients that are dealing with post-COVID, long COVID. We have 2 phases of that study. Please contact us and see if this could be an opportunity for you to get the care and information that you need.
Hola, soy la doctora Ana Palacio, de la Universidad de Miami. Me encantó participar en el podcast de hoy y quería invitarlos a considerar el estudio COVID UP. Este estudio está tratando de determinar por qué las personas no mejoran después de COVID. Si les interesa saber más de este estudio, por favor llamen al número 305-275-5450 o pueden escribir al email INIMresearch@nova.edu. Les agradezco mucho su interés y los vemos la próxima vez.
It's just amazing. First of all, it's a world-class facility. I mean, it's just, they're treated with such respect and dignity. I mean, it's like, I would send, it's like a 5-star. It's beautiful. But I think that just that honoring, right, their struggle. And I've been, unfortunately, with family members and clients sometimes into some VA facilities, and I don't feel like there's a lot of honor and dignity in some of the care. I'll just say that that's what I've personally experienced with some of my family members. I loved walking in and them having that feeling. And I loved also, to your point, the camaraderie. So the clinic that I went into, you have, more than one. You have the hyperbaric chambers, and there was men and women coming out and just peering at different tattoos. And I saw people that had some amputations and some, you could see some of the physical injury from wartime, but you could see definitely some of the non-apparent injury from wartime also that was present in there.
That's such an important point that you made, because in all of the videos that we do, the exit videos, when we interview them at the end and we do the brain mapping and they're doing well, all of them say to me, especially the individuals who are amputees, say, you know what, this injury seems much worse, but my brain injury is what incapacitated me, and no one can see that, and now that's better. So it's really interesting what you're saying, because that hidden injury that no one understands with regard to their post-traumatic stress, their memory disorder, or the cognitive dysfunction, et cetera, that impairs their ability to live a normal life, no one sees, where you can see the amputee component. But they said to me, that injury of the brain was much worse than losing this limb, and now I have my brain back. So that point that you're making is so extraordinary, because that's what they tell me on the exit interviews.
And I think I see that with so many individuals that are dealing with aspects of chronic disease that can be not visually seen, right? At the Institute, and I know you do too, we get patients that were there. I said to Dr. Klimas the other day, their 10th doctor stop, and she said it's 20th anymore. It's just a different time, Haylie. And every time they go see someone, they have to justify how they're feeling, why they're feeling, describe it. Where if you have a cast on, right, you just go, it's right here, dummy. You know what I mean? Or you have a radiograph or an x-ray or something. And so in the brain space, and I was in a near fatal car accident. I had a massive, I was at the Brain Injury Recovery Center for 3.5 years.
Wow.
Yeah. And fortunately, they did a lot of different modalities. I was so fortunate to be in a space where they didn't just believe in, maybe a neurochemical medication, but many other modalities, including non-cognitive biofeedback and EMDR and, one brain. And I could go down the list, and IV therapies. And I was really, really lucky. Yeah. But it was one of those things. And I also did a lot of speech therapy. And I still have this one little pocket of memory. I don't remember 2 years of my life, like at all. It's like someone took an eraser.
Mm-hmm.
The rest of it is so vivid, before and after, but those are just gone. Individuals, all those people that are out there right now that maybe they're lucky enough to see a neurologist, how can they communicate with their physician that they want to engage in some additional therapies to get well? Like, how do they communicate? Like, hey, I want to go see Dr. DeFina. Do they need a doctor's referral? Do they do a phone consult with you? Like, how do people have the opportunity to engage?
Okay, depending upon the disorder, it's very interesting, because most neurologists, and I used to be a professor in neurology departments, so a lot of my career, most neurologists are very skeptical about doing anything outside the box. Right. So essentially, we get
the
very
patient
few,
has to push it.
Exactly. We get very few neurologists who are very oriented toward understanding other things that may be helpful and research that we do. So those are the neurologists that refer to us. But typically, many people, like with severe traumatic brain injury and even multiple concussive injuries, when they don't get to the point of really manifesting the change that they want, the doctors basically say, you've reached your level, and that's it. But they know that they want more. And then eventually, when those people do get to us and they reach a much higher level of functioning, they question, well, what happened? Why was there no information in regard to this? Despite the fact that we have publications, we do lectures, et cetera, it's not part of mainstream medicine. And things change at a glacial pace in mainstream medicine. Things are controlled by big pharma in mainstream medicine and the FDA. So there are a lot of things that are not available to doctors that work in hospitals and even private practice physicians. And when they see the work that we do, some physicians welcome it and say, wow, this is great, you should try it. Whereas other physicians say, I would never do that, because that's not the state of the art of our practice, which is way back in the ice age, the state of the art of the practice.
Especially in neurology. Right. I mean, especially the brain has been, quote unquote, untapped, right? As far as the ability to do, there's robotics and neurosurgery, yes, but I hope to not ever have neurosurgery. I hope to be able to impact my brain without removing my skull. So one of the things that our community was asking us is, I just want to go back to different aspects of brain trauma. So we are seeing I don't know what we're going to do. We are so flooded in our practice with long COVID. And as I told you, I built this very large community so people could come in and ask questions. And we had a advanced clinical last night. One of the community members volunteers for all of our coaches to kind of get on and talk about their case. So what docs would maybe call it ground rounds, right?
Right.
And we had a woman that was in Pennsylvania that had a phenomenal physician that she worked with, and she was mentioning this doctor. So it's like this massive kind of network of things. But we're seeing so much long COVID, and people are seeking outside therapies and care because, we had somebody that was down at the Yale long COVID thing. They just drew a bunch of blood. I mean, that was their trial and their study that they spent, time staying down in Connecticut for. And they said, that's cool. I don't mind being part of the research, but I want to be part of the cure. Like I want to get better. What is going on? What's happening in the brain that you're seeing with long COVID?
This is a great question. Your prior guest works with me on this, actually, Dr. Canner. So I have a protocol for long COVID. So we're looking at infectious encephalopathy. So you have a brain syndrome with infectious encephalopathy. There's toxic changes that take place or metabolic changes that take place. So you have an infectious encephalopathy that creates a lot of the difficulties that are long-term and essentially impact memory, cognitive functioning, emotional regulation. So we put them through a whole process of assessment, because not all COVID patients are the same, just like everything else. So we do non-invasive assessment, and then we do, it's called non-invasive neuromarker-guided neuromodulation. So that's the fancy name for what we do. And what we do for those patients is we look at various neuromarkers, electrical, magnetic, chemical, like I talked to you about before. We look at their whole gut biome in relation to their brain, because that's your second brain with another 100 billion neurons. And then once we understand the mechanisms that are impaired, we reduce inflammatory processes, as we spoke about before. We increase mitochondrial functioning, which is very critical, and basically go through a whole process using QEEG neurofeedback protocols for entrainment, for memory, et cetera. We use transcranial direct current stimulation, alternating current stimulation. We use transcranial magnetic stimulation. So depending upon the modalities that we select to be able to enhance those particular functions within that circuitry, but they're all non-invasive.
And it's very customized.
And very customized. Okay. And hyperbaric plays an important role in many of these. So once we put that together, we've had really good success with long COVID in doing this. And essentially, unless all those mechanisms are understood and you only get to fix one, you're going to have a limited effect.
Right. And that's that feedback piece of our whole body, of the endocrine system and the immune system and the brain having such a conductor role in all of it. In the goal to not come to your office with a broken brain, right? Whether that's Alzheimer's or TBI or mycotoxin,
Absolutely.
aspect.
Absolutely.
Give me some of the modifiable lifestyle things that you think are important. I always say that staying healthy takes a lot of effort, and getting healthy once you're in a state of disease is a journey.
Exactly.
And so what can some people do preemptively, preventatively? What do you like to see people focus on? I'm going to ask it this way. What is 2 things that you would say don't ever do because you're going to end up in my office later? Like I always tell people, smoking's never a good idea, right?
Correct.
What are some modifiable things that people can totally take out of their life that is going to help protect their brain?
Right. Oh, that's a great question. So smoking, excessive use of alcohol, and other recreational drugs, marijuana has become a big thing right now. And there's a lot of deleterious effects of that as well, which I know we can't get into today. But essentially, being able to understand diet is extremely important. So your diet has, not using sugar products, not using dairy products, not using gluten products. So there are so many aspects of diet that we can really get into and maybe spend a whole session on that really are very important. And we give people a lot of very good information, valuable information as to things to avoid and things that are very helpful with regard to your diet. Sleep is another very important component. And also the looking at what nutrients your body needs. So people go to health food stores, they read an article, they have a memory issue, they see a commercial on TV, they go out and they buy a product, but that product may not have the specific components that will be involved in regulating that particular form of memory issue.
Absolutely. And I'm going to just throw this out here. With Big Pharma buying up supplement companies left and right.
It's a big problem.
It's a massive problem. So, I have a supplement company, and we all bid internationally for raw ingredients. And it has gotten so easy to get high quality raw ingredients for my product because the pharmaceutical companies are buying the worst and the cheapest.
Oh, absolutely. 100%.
I used to always say the bottle
100%.
is worth more than what's in it. Now the cap is worth more than what's in it.
I think you're absolutely correct.
Shocking. The bidding war that used to happen for out of Milan, Italy, methylated folic acid that I would want to buy. There used to be, bidding about it. All these people that have bought up these beautiful, holistic mom and pop supplement companies.
Oh my God.
And they have completely changed the raw ingredient, and they don't have to change the label. Right?
Yeah, absolutely.
It's just heartbreaking. So I appreciate you saying that. I need to have you back to talk about sleep. I need to have you back to talk about nutrients.
Yeah, the gut biome, being able to really understand food sensitivity and allergy, which impact people that they're unaware of. And what we do also is we do a genetic mapping on everyone. If you don't have the genetic mapping along with all of the other testing that we do, you're missing a major part of what you need to make the appropriate decisions. I don't know how any doctor could write a prescription without doing genetic mapping, because it'll tell you right there what drugs would never work, what drugs would be deleterious to that individual's health.
Drugs. Oh. I mean, it's just crazy. It's accessible and it's available. And therefore, once it's accessible and available, and it's getting cheap too. The genetic testing is getting better and better from an affordability perspective. But to your point, from a pharmacological perspective, knowing the difference between you and I and Grandma Gigi and my 5-year-old, right? Of what they should be taking, whether it's injected in the body or swallowed or put on the body as a patch, it is now a responsibility because it's available. I love that you say that. And I just want to,
You're a wealth of knowledge. You're amazing. The things that you do and the things obviously that we're talking about are the critical issues.
They are the critical issues.
If the population understands that, they can do so many things to help themselves get better and stay healthy.
And I always remind you out there that you are the captain of the team, right? You are employing a physician.
Absolutely.
You are employing a healthcare provider. And if they are not doing an A+ job, because it has to be A+ on behalf of your health,
100%.
fire them and get somebody else and fire faster,
100%.
right? I built this community because I wanted people to have access to brilliant people like you. And I put together my nutrition plans, not based on some crazy theory, but real clinical implications that impact the gut, that impact the brain, that first and foremost reduce inflammation and modulate the immune system. And so it's not theory, it's a playbook for real people that are in real struggle. I just want to thank you so much for being here. I know how incredibly busy you are and as busy as your practice is. I will make all of the resources available to our community so that they can reach out and to
Absolutely.
you. I really, really appreciate it. It means everything to everybody in our world. It is hard to have access to good medicine.
Correct.
And I feel like the pandemic made what felt out of reach feel absolutely impossible for so
Correct.
many. Yeah. So your
Very
space just exudes hope. And I just love being there, even with your puppies there and stuff like that. But I love being there because it's such an inspiration that I see people having real changes in a part of the body that's really hard to impact. So thank you so much for being here. And please promise you'll come back.
Thank you so much for inviting me, and I would be delighted to come back. You are amazing, and I love the message you get across because it's so essential for people's health, and you're just amazing in what you do. So thank you so much.
Thank you. We'll talk soon.
Take care.